All right, ready for a deep dive. We're tackling spinal lymphoma in a goat.
In a goat?
Yeah, a goat. Based on a case study from veterinary radiology and ultrasound.
Sounds intriguing.
So picture this. A 3-year-old pygmy wetter.
Okay.
He can't use his hind legs, at all. Completely paralyzed.
Yeah.
For 3 months.
Oh, wow.
Vets thought it was Parallelephastrongylus tenuis at first. Brainworms.
Yeah.
But to make things worse, this goat also had a shoulder injury from bumping into another goat. Treated for both, but no improvement.
So a real medical mystery.
What did the neurological exam show?
Classic spinal cord dysfunction, non-ambulatory paraplegia, meaning the back legs were totally paralyzed, no deep pain perception in the hind limbs, absent withdrawal reflexes too.
Wow.
Even the cutaneous truncate reflex was gone in the T3L3 region. Pain on spinal palpation.
So where did they even begin with this?
All right. The first challenge was narrowing it down.
I bet.
Traumatic spinal cord injury, fibrocartilaginous embolism, and of course neoplasia.
Neoplasia.
A tumor.
Okay.
They started with lumbar spinal radiographs, but they didn't show much.
So what then?
They went for an MRI of the lumbar spine.
An MRI. Did that clear things up?
It did. They found a heterogeneous T2W hyperintense extradural lesion.
Okay, break that down for me.
Basically an abnormal area outside the dura mater, one of the membranes around the spinal cord.
Right.
It extended from L1 to L6. It was compressing the spinal cord.
Hence the paralysis. Anything else point to lymphoma?
Yeah, the HASTE sequence,
HASTE.
a type of MRI sequence, showed a signal void from L1 to L6. Basically no signal. More evidence of an abnormality.
Did this lesion go beyond the spinal cord itself?
It did. It extended into the intervertebral foramina.
The openings between the vertebrae where the nerves exit.
Exactly, from L1, L2 to L5, L6.
Wow. Did the vertebrae themselves show anything?
Yeah, T2 hyperintensity and T1 post-contrast enhancement in the L5 and L6 vertebral bodies.
But the bone marrow was involved.
Looks like it. And there was more. The lesion went into the epaxial and hypaxial muscles.
The muscles around the spine?
Yep, from L2 to L4.
This lesion was everywhere. Did that narrow down the diagnosis?
Definitely. Lymphoma was the main suspect at that point.
Makes sense. This widespread lesion, the intervertebral foramina involvement.
And those paraspinal muscles. The MRI patterns, too.
Right, all aligning with what's seen in lymphoma in other animals.
Dogs and cats, especially.
So lymphoma was the top contender. But how did they confirm it?
Ultrasound-guided fine needle aspiration of that paraspinal lesion.
Right.
They used ultrasound to guide a needle into the lesion and get some cells.
Yeah.
It was lymphoma.
Confirmed. So spinal lymphoma in a goat.
A rare case.
Definitely. Documented cases are very rare.
This case report adds a valuable piece to the puzzle.
For sure. With all those MRI findings, which ones really pointed to lymphoma?
Well, the T2 hyperintensity, that's common in lymphoma and other species.
Yeah.
And then the intervertebral foramina involvement and the paraspinal extension.
Classic science. But was there anything unusual on the MRI?
Actually, yeah. The extradural and paraspinal components showed pre-contrast T1 hyperintensity.
Interesting. Isn't T2 hyperintensity more typical in lymphoma?
You're right, it is. Pre-contrast T1 hyperintensity isn't reported as often, though it has been seen in some lymphoma cases in cats and dogs.
Could this be more common in goats with spinal lymphoma?
That's the...
More research is needed.
Absolutely.
To see if this is unique to goats.
Exactly.
What if we could find specific MRI markers for caprine lymphoma?
Imagine that.
Earlier diagnosis. More accurate diagnosis.
It could change everything.
Okay, let's recap those key MRI findings. Extradural lesion,
Right.
dorsal to dorsolateral, causing compression,
Right.
T2 hyperintense,
Uh-huh.
and T1 hyperintense even before contrast,
Right.
extending into the intervertebral foramina and the paraspinal muscles.
Yes.
Vertebral involvement too.
Sparing the cortex, though.
This case really shows how powerful MRI can be.
Absolutely. Especially for neuro cases.
When you need to pinpoint the lesion.
Exactly.
It's a reminder that even common presentations, like hind limb paralysis,
Can have unexpected diagnoses.
you never know what you'll find.
That's for sure. This raises a question, though.
What's that?
Could there be other undiagnosed spinal lymphoma cases in goats?
Because it's so rare.
Exactly.
That is the million-dollar question. If research can reveal those hallmarks,
Specific to goats
then we might detect it sooner.
and improve treatment strategies.
Potentially, it could make a big difference.
This case also really shows how important it is to think broadly.
Keep a broad differential diagnosis.
Yeah. especially when those first treatments don't work.
Like in this case, the suspected parasite and the shoulder injury might have masked the lymphoma.
Exactly. Stay open to all possibilities, especially with neuro cases.
They can be tough to diagnose.
Absolutely. This case also highlights something else.
What's that?
The insights we can get from studying rare diseases.
In different species.
Yeah. Comparing and contrasting can really deepen our understanding
Of the disease process.
and maybe even point to new research directions.
And better diagnosis and treatment.
Absolutely.
Okay, so they confirmed it was lymphoma. What did they figure out the subtype?
Unfortunately, the report doesn't say. But it's worth noting that some subtypes, like B-cell lymphoma, are more often linked with spinal cord issues in other animals.
Interesting. It'd be fascinating to know if this case aligns with what we see in other animals.
Definitely. More research could clarify things.
Like the prevalence of different subtypes in goats.
And how they present.
Right. Speaking of research, this case brings up a question.
What's that?
Could there be unique features of spinal lymphoma in goats?
That set it apart from other species.
Exactly, like that pre-contrast T1 hyperintensity.
Right. Maybe that's a distinctive feature in goats.
It's worth investigating.
Definitely. Comparing MRI findings in goats with other species could be revealing.
What if we found a specific MRI pattern?
Just for goats.
That'd be a game changer for early diagnosis.
It would. Early diagnosis is so crucial.
But the prognosis for spinal lymphoma isn't great.
No, it's generally guarded no matter the species.
In this case, the owner chose not to pursue further treatment.
And the goat got palliative care.
What are the usual treatment options for other animals?
Usually a mix of chemotherapy and radiation. Sometimes corticosteroids like prednisone to manage inflammation and shrink the tumor.
So could those work for goats too?
That needs more research. But lymphoma seems to present pretty similarly across species.
So goats might respond similarly.
It's possible. Of course, any treatment needs careful thought.
Looking at the individual goat.
The type of lymphoma, the owner's willingness.
And their resources.
Absolutely. It's essential to talk about the benefits, the risks, and the costs.
So everyone can make informed decisions.
Definitely.
Okay. This case also highlights the importance of advanced imaging.
Like MRI.
Especially in neurology.
It's amazing the detail you can get.
The spinal cord, the tissues around it, even the vertebrae.
In this case, the MRI was key. Not just for finding the lesion.
But for characterizing it.
The extent, the location, those signal characteristics.
All pointing to lymphoma.
Technology has changed everything.
It really has. We can diagnose and treat these complex conditions much better now.
Speaking of advancements,
Yeah.
there's a lot of interest in contrast-enhanced MRI.
Did they use that in this case?
They did. They gave the goat Extradural intravenously.
And then got post-contrast T1 weighted images.
Yes.
What did those show? Did it reinforce the lymphoma suspicion?
It did.
Yeah.
The images showed a heterogeneous contrast enhancement in the lesion.
And that's often linked with lymphoma.
It is. But you have to remember,
Yeah.
contrast enhancement patterns can vary.
Depending on the lymphoma type, the stage.
Other factors, too.
So it's helpful, but not foolproof.
Exactly. It's just one piece of the puzzle.
You need to consider everything
Clinical presentation, signal characteristics, cytology.
to get a clear picture.
Right. This case shows how important it is to be systematic.
Neurological exam, advanced imaging, cytological analysis.
To solve the mystery.
It's also a good reminder that even though it's rare in goats,
Spinal lymphoma.
yeah, it should still be on our radar.
Absolutely. Any signs of spinal cord dysfunction, you have to consider it.
Weakness, paralysis, difficulty walking, pain.
Any of those, see a vet immediately.
And if they suspect lymphoma, what should they do?
A thorough neurological exam, for sure.
To pinpoint the lesion.
Radiographs can rule out bone problems, but MRI is the gold standard.
For visualizing the spinal cord and those surrounding tissues.
And if the MRI suggests lymphoma,
A biopsy.
guided by ultrasound or something similar.
To get a definitive diagnosis.
Exactly. Early diagnosis is so important
It gives you the best chance.
for treatment options and a better outcome.
So even though it's rare, we need to keep spinal lymphoma in mind.
Absolutely. We need to be thorough and consider those less common conditions.
Okay, let's get a bit more technical. The report mentions things like T2 hyperintensity, T1 hypointensity, contrast enhancement.
Right.
Can you break those down for us? What do they mean, especially with lymphoma?
Of course. Let's start with T2 hyperintensity. MRI signals vary depending on things like water content.
Okay.
T2 weighted images are sensitive to water changes.
So if a lesion is T2 hyperintense,
it means it's brighter on a T2 weighted image.
Brighter than the surrounding tissue.
Exactly. Often that brightness means more water content.
Which you see in
inflammation, edema, certain tumors.
like lymphoma.
Right. So it's a clue.
But not specific to lymphoma.
Exactly.
Okay, what about T1 hypointensity? How's that different?
T1 weighted images highlight different things.
Yeah.
Fat content, protein concentration.
So T2 shows water.
And T1 shows the makeup of the tissue.
Got it. So T1 can help tell different lesions apart.
Exactly. Some tumors with lots of fat are brighter on T1.
That's T1 hyperintensity.
Right. But lesions with low fat are darker.
T1 hypointensity.
Yep. So by comparing T1 and T2, we get a clearer picture.
Of the type of lesion.
Exactly.
Now, contrast enhancement. You said contrast agents highlight vascularity and permeability.
Uh-huh. You inject them and they circulate.
And tumors light up.
Often, yes. They're usually highly vascularized.
So the contrast builds up, making them stand out.
Right. So contrast enhancement can help you spot tumors.
And see how big they are.
But it's not just tumors.
Other things can cause it too.
Yeah, like inflammation.
Mm-hmm.
So it's valuable, but you need context.
Okay, so in this goat, the lesion was T2 hyperintense, T1 hypointense, and showed contrast enhancement.
That's typical for lymphoma.
T2 hyperintensity for the extra water.
T1 hypointensity for the low-fat content.
And contrast enhancement for the vascularity.
All classic lymphoma signs.
This case really demonstrates how useful MRI can be.
For sure. Using different sequences and contrast can be really informative.
For diagnosing spinal cord issues.
It's remarkable technology. MRI has transformed how we see the central nervous system.
Okay, but MRI isn't perfect. What are its limitations?
You're right, it does have limitations. It's important to remember that.
For instance, it can miss small lesions.
Especially in hard-to-see areas.
The resolution keeps getting better, but there are limits.
And sometimes you get artifacts.
Artifacts.
Distortions in the image.
Would look like pathology.
Yeah. They can be caused by lots of things.
Like
patient movement, metal implants, air or fluid in the body.
So you need a skilled radiologist.
To interpret the images correctly.
And avoid mistakes.
Absolutely. Experience matters.
An MRI can be expensive.
It can. You have to weigh the benefits and the costs.
Sometimes other imaging might be better.
Or more affordable.
Like radiographs or ultrasound.
It depends on the situation, what you're looking for.
But even with limitations, MRI is still an amazing tool.
Absolutely. It gives us so much detail.
About the central nervous system.
It's revolutionized how we handle neuroconditions.
This goat was a pygmy wether. Are there breed predispositions for spinal lymphoma in goats?
Not that I know of.
So this was just bad luck?
Probably. Lymphoma is more common in certain dog and cat breeds.
But we don't know much about goats.
Right. Maybe there are subtle breed differences, but we haven't found them yet.
Because it's so rare.
Exactly. We need more research to understand what causes lymphoma.
In different animals.
Definitely. Every case teaches us something.
Okay, what does this mean for goat owners? Should they be worried?
Well, it's rare.
But possible.
It should be on the list of possibilities.
Especially if there are neurological signs.
If you see weakness, paralysis, difficulty walking, pain.
Go to the vet right away.
Early diagnosis is key.
And while we can't prevent lymphoma for sure,
a healthy environment and good overall health can help.
Boost the immune system.
Exactly. A strong immune system is important.
This case reminds us to be watchful.
Proactive about healthcare.
And have a good relationship with your vet.
It's a good reminder that even tough goats can get sick.
And early intervention is best. You mentioned MRI. Can you tell us more about the role of radiology in general?
Oh, it's vital. It helps us diagnose and manage so many conditions.
It covers a lot of techniques.
Radiography, ultrasound, CT, MRI.
They all use different ways to create those images.
So we can see bones, organs, tissues, even blood flow.
It's amazing what we can see now.
Radiology helps us find fractures, dislocations, tumors.
Infections, inflammation, so many things.
It guides surgeries, helps monitor treatment, assess overall health.
It's much more than just pictures.
It's about information that helps us make decisions.
It's a core part of veterinary medicine.
It helps us get the right diagnoses, make the right treatment plans, and get better outcomes for our patients.
And MRI was key in this goat's case. Can you explain how it works? Why is it so good for the central nervous system?
It uses a strong magnetic field and radio waves
to make images.
Very detailed images. It's especially good for soft tissues.
The brain, spinal cord, muscles, organs.
Unlike X-rays, which mainly show bones.
MRI can tell different soft tissues apart.
Based on water content, fat content, other things.
So we can see things that other methods would miss.
Like in this case, the vets saw the lesion on the spinal cord.
They saw how big it was, its signal intensity.
All pointing to lymphoma.
It's really changed how we approach neurology.
Being able to see the central nervous system in such detail.
We can diagnose and manage so much better now.
Absolutely.
It's incredible how much MRI has advanced our understanding of neurological conditions.
Absolutely. Now, let's think about the vet's role. What can they do to improve things?
In cases like this?
Yeah, with spinal lymphoma in goats. For starters, they need to remember it's a possibility.
Even though it's rare.
Right. It should be on their list of potential diagnoses.
When a goat shows neurosigns.
Especially hind limb problems.
So a thorough neurological exam is essential.
Absolutely. Figure out where the issue might be, how bad the deficits are.
Checking reflexes, gait, posture, pain perception.
All of that. And if they suspect lymphoma, imaging is crucial.
MRI, right.
Ideally, yes. It gives you those detailed images of the spinal cord and everything around it.
So you can see the lesion clearly.
Exactly. Early diagnosis is so important.
For treatment options.
And potentially for the prognosis.
So referral to a specialist might be needed.
Yeah, a neurologist or oncologist.
For more specialized care.
Right. But any treatment decisions should always involve the owner.
Of course.
You have to consider the goat's age, their health, the owner's finances.
And their willingness to go through with treatment.
It's a big decision. So open communication is crucial.
Talking about the benefits, the risks, the costs.
All of it, so everyone can make informed choices.
This case really shows how important it is to be thorough.
And to communicate clearly.
To get the best outcome.
For the goat. For the owner.
It also shows that we need more research.
Definitely. To better understand spinal lymphoma.
Maybe find risk factors.
And develop better treatments.
Treatments with fewer side effects.
There's still a lot to learn.
This deep dive has been fascinating.
It has. We've covered so much.
From MRI to diagnosis to treatment.
Spinal lymphoma in goats is complex.
But this case taught us a lot.
About neurology. About taking a team approach.
Even rare cases can be incredibly valuable.
For learning, for research, for new ideas.
And it reminds us how important vets are.
For protecting animal health.
For speaking up for our patients. And for supporting that human-animal bond.
It's about more than just medicine.
It's about compassion.
It's about never giving up on learning.
And it's about making a difference. For animals and for the people who love them. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.